Next, let's discuss the physician's duty to treat. Physicians are ethically and legally obligated to place patients' interests above their own, especially in emergency situations. The Emergency Medical Treatment and Active Labour Act, or EMTALA, mandates that emergency departments must screen, treat and stabilise patients regardless of their ability to pay or their behaviour. Consider a scenario where a patient with a gunshot wound arrives at the emergency department using racially charged language. Despite the offensive behaviour, the physician must provide immediate care to stabilise the patient. This duty to treat ensures that all patients receive the care they need, even in challenging circumstances. Next, let's talk about patient autonomy. Patient autonomy is a cornerstone of medical ethics. It mandates that patients have the right to be informed about treatment options and to make decisions about their care. However, this right does not oblige physicians to provide non-indicated or inappropriate treatments. Physicians should always ensure that the requested treatment benefits the patient and adheres to ethical and evidence-based standards. For instance, if a patient with a minimal smoking history requests a CT scan for lung cancer screening, the physician may refuse if the risks outweigh the benefits. Instead, the physician should explore the patient's concerns and recommend more appropriate diagnostic options. Next, let's talk about proportionality. This principle ensures that the methods used to achieve a medical goal are necessary, reasonable, and not excessive. For example, using physical restraints on a delirious patient who is a danger to themselves or others is justified if it ensures safety and facilitates necessary medical evaluation. Once the acute danger has passed, the restraints should be removed to avoid excessive force. Imagine a patient with acute delirium who becomes aggressive in the emergency department. The use of restraints and sedative medication is necessary to prevent harm and allow for a proper medical evaluation. Once the patient stabilizes, these measures should be promptly discontinued. To illustrate these principles, let's consider a real-life case study. A 16-year-old emancipated minor presents to the emergency department with severe abdominal pain. She has a history of substance use and is homeless. The healthcare team quickly diagnoses her with acute appendicitis, requiring immediate surgery. Given her emancipated status, she consents to the surgery herself, and the team proceeds without parental involvement. The surgery is successful, highlighting the importance of understanding exceptions to informed consent and the physician's duty to treat. In this episode, we explored key ethical principles in healthcare, including exceptions to informed consent, the physician's duty to treat, patient autonomy, and proportionality. These principles are fundamental to providing compassionate and ethical medical care. Remember to engage with the pre- and post-podcast quizzes and use the Anki flashcards to reinforce your understanding of these concepts. Your active participation will help solidify your knowledge and prepare you for your exams and future medical practice. Thank you for tuning in to Med Madness. Stay curious, stay compassionate, and keep learning. Until next time, take care. Don't forget to subscribe to our channel and share this podcast with your peers. Follow us on social media for updates on upcoming episodes and more educational content. See you in the next episode.